Hi, I'm Alan Jury. I'm a social worker and a trainee mental health officer in the integrated mental health team. Well, I had some discussions with people in my team, mainly the development worker at the time, and was encouraged to apply. I think for anybody thinking of applying, the first thing to do is speak to your manager and check that they would be happy for you to be away from your post for 7 or 8 months, because that's what's required. There's an application form that has to be filled in. It's quite a lengthy form, and a 1,000-word academic essay, and that is to test out that you have the sort of necessary knowledge and background in mental health to undertake the course. You have to get an academic reference as well, and certainly for myself and many others who have been out of full-time study for a long time, it would have to be a manager that does that rather than the university. So it would be somebody, it can't be your current manager, so it would have to be somebody who's previously worked with you, who can comment on your ability to write academically and study at that postgraduate level. So the first module is a module kind of based on your kind of base knowledge in mental health. So it's called Mental Distress Critical Perspectives. So it's an exploration of what mental distress is, whether it's purely an illness or whether there's social factors involved as well. And just this kind of exploration of different ways of thinking about mental health. And that's assessed via a 2,000-word essay at the end of that module. So the second module is all based around the Mental Health Care and Treatment Act 2003. It starts off with an academic component. I think it's 10 days or so where you learn all about the Act, where it came from, how it came into being, all the kind of principles and ideas behind the Act. The second part of the module is a practice component, so you're on placement for 37 days within your own local authority mental health team, and you undertake pieces of work using the Mental Health Care and Treatment Act. With that module, you have to submit a placement report, which is your evidence for how you've met all the learning foci identified by the university. You also submit a 3,000-word essay, which is a critical analysis of a piece of work you've done on placement. During that module is also a law exam, which is an open book exam, which essentially tests your knowledge of the legislation and your ability to find things within the Act itself. So the third module is around criminal procedures. So that's all around when someone with a mental health difficulty commits an offence and how they are dealt with through the court system. So that'd be things like assessing people for short-term detentions, applying to the mental health tribunal for longer-term measures like compulsory treatment orders. You often find yourself giving evidence at tribunal hearings. Undertaking social circumstances reports, so quite often, having to find out a lot about someone's background, speaking to their family members, other professionals as well, and a lot of the work is joint work with health colleagues, which is really interesting as well. And the fourth module is MHO role and context again. At this time it is around the Adults with Incapacity 2000 Act. Similar to the second module, it's an academic component to start with, learning all about the principles and the background of the piece of legislation, and then there is a placement after that as well, where you undertake pieces of work under the AWI Act. I think the sort of main difference, first of all, is the length of the placement. So social work placements tend to be either 3 or 6 months, whereas MHO placements are only kind of 30 odd days. So it's very intensive. You have to kind of hit the ground running straight away. There's no caseload allocated to you as such. It's more pieces of work that are allocated to you. So it's a bit different in that regard. You do quite a lot of shadowing with the qualified workers and then take pieces of work on via that. Sometimes you'll be shadowing, sometimes you'll be taking the lead on pieces of work as well. Yeah, so I think the main difference is that it's very, very intensive. You've got access to the university online system. It's really easy to negotiate, even if you're not kind of particularly great at IT. It's really quite straightforward, and within that, all the readings that you need to do are posted up there, so you can access them quite easily. There's online chat rooms between yourself and your fellow students, which is really good for sharing ideas and extra readings and things like that. So there's also live lectures and contributions from outside speakers that are posted on the system as well, and that's been particularly the case during the pandemic, so I'm not sure if that will continue, but that's really useful as well. In terms of support, you're also assigned a tutor as well who oversees your studying as well, so you can go to them with any issues or any difficulties you might be having. So you still have your tutor from the university involved, so they can be a point of contact if you're having any sort of problems or issues on placement. Certainly in our cohort, we have kept in touch with each other via the university online system, so sharing all our experiences and our stuff that we've done on placement. We've also got a WhatsApp group as well, which I'm sure that's kind of quite a popular thing for everyone. So staying in touch with your fellow students and your tutors is probably really important. You have a practice assessor who's a experienced MHO within the mental health team, so they're obviously responsible for overseeing your pieces of work that you're doing on placement. And really, because you're within the MHO team, you've got all the other MHOs there as well to lean on and get experience from them. So doing a bit of shadowing from them, getting some advice from them is really good, and just kind of seeing how different people work. And everybody's really supportive and happy to help. I would really encourage anybody with an interest in mental health to go on the course. I think that I've personally really developed my knowledge in the area of mental health in the short time I've been on the course so far. And I think looking ahead when you qualify from the course, it means that the work that you'll be doing will have a real kind of variety about it as well.